Nurse Angela Pritchard had been with St. Luke's Memorial Hospital for 11 years when she made a decision that would destroy her career, cost the hospital $3.8 million, and expose a pattern of racist gatekeeping that administrators had ignored for nearly a decade. She was 46 years old, experienced enough to recognize respiratory distress in a child, but apparently convinced that her judgment about who deserved immediate care was more important than medical protocols. One Friday evening in a crowded emergency room, she looked at a black mother holding a struggling child and saw not a medical emergency, but an inconvenience. What Pritchard did next, refusing treatment, dismissing credentials, and ignoring clinical signs of hypoxia, would become proof of how racial bias in healthcare kills trust, damages bodies, and ends careers. A black woman in her late 30s, Maya Richardson, stood at the triage desk holding her 7-year-old daughter Jasmine, whose breathing had become increasingly labored over the past hour. The pulse oximeter on Jasmine's finger read 89%, well below the normal range. Maya's nursing badge from Mount Sinai was clipped to her jacket. No drama, no hysteria, just a trained medical professional recognizing a pediatric emergency and seeking help. But Nurse Pritchard saw her through a filter, so distorted by assumptions about who complains unnecessarily and who deserves to wait that she couldn't process a child in respiratory distress. Before we continue, where are you watching from? If this is your first time here, please hit that subscribe button. Stories like these need to be shared, and your support helps us bring more truth to light. St. Luke's Memorial Hospital sits on the corner of Jackson Boulevard and 14th Street in Chicago's West Loop. It's a Level 2 trauma center that serves one of the city's most diverse neighborhoods, a 320-bed facility that opened in 1978 and has seen generations of Chicago families through their worst moments. The emergency department handles roughly 400 patients daily, with a staff of 22 nurses, 8 attending physicians, and 6 residents rotating through 12-hour shifts. The building itself is an imposing brick structure with large windows on the ground floor, its emergency entrance marked by red letters visible from blocks away. Inside, the ER stretches across 12,000 square feet, treatment rooms lining both sides of a central corridor, supply closets stocked with trauma equipment, crash carts positioned at strategic intervals. It was 6:38 p.m. on a Friday in November. The early winter darkness had already settled over the city. The temperature had dropped to 34 degrees, and a light rain had started falling, making the evening feel colder than it was. Inside the ER, fluorescent lights hummed overhead, casting everything in that particular shade of institutional white that makes everyone look slightly ill. The waiting room was packed, families with sick children clutching tissues, elderly patients with chronic conditions shifting uncomfortably in plastic chairs, a couple of minor injuries from a fender bender comparing insurance information. A television mounted in the corner played muted local news, the smell of antiseptic mixed with coffee from the vending machine. The triage desk sat at the entrance, a long L-shaped counter where nurses made the critical initial assessments that determined who got seen immediately and who waited. Behind it, Nurse Angela Pritchard controlled the gate, the kind of Friday evening where nothing catastrophic had happened yet, but the night was young and the city was busy. Maya Richardson had been an ICU nurse at Mount Sinai Hospital for 12 years. 12 years managing the sickest patients in Chicago, the ones clinging to life by ventilators and vasopressors, and round-the-clock monitoring. She'd worked through the pandemic when ICU beds ran out, and nurses worked 16-hour shifts and people died alone. She'd intubated COVID patients, run codes on cardiac arrests, and held the hands of families making end-of-life decisions. She'd seen respiratory failure in every form it takes: ARDS, pneumonia, pulmonary embolism, asthma exacerbations. And she knew what it looked like when someone's lungs were failing. Maya had graduated from Rush University College of Nursing in 2011, finishing in the top 15% of her class. She'd completed her ICU fellowship at Northwestern Memorial, one of the most competitive critical care programs in the Midwest. She'd been awarded the Excellence in Nursing Award from the Illinois Nurses Association in 2019. She'd published 2 articles in the Journal of Critical Care Nursing on early recognition of sepsis. Her colleagues called her the nurse who caught things before they became catastrophic. Her patients called her the one who made them feel safe. At 38 years old, Maya Richardson was exactly where she'd worked to be. respected, trusted, and raising a daughter who watched her mother save lives and thought nursing was the most important job in the world. She was a single mother by choice, having decided at 30 that she didn't need to wait for a partner to have the family she wanted. Jasmine had been born 3 months premature, spending her first 2 months in the NICU, where Maya had once worked as a new grad. Those terrifying weeks watching her own daughter fight for every breath had made Maya even more committed to her work in critical care. She understood what families felt when they stood at bedsides praying for miracles. She lived on the city's south side in a small 2-bedroom apartment filled with Jasmine's artwork and nursing textbooks. On her days off, she volunteered at a free clinic in Englewood. Her colleagues joked that she couldn't turn off being a nurse, even when she wasn't at work. Maya would smile and say she didn't want to. That Friday evening, Maya had picked Jasmine up from her after-school program at 5:15 p.m. Jasmine had seemed fine that morning. No fever, no cough, just her usual energetic 7-year-old self. But when Maya arrived, Jasmine was sitting on the floor, looking pale. The program director said she'd been complaining about feeling tired. Maya took her temperature, 101.2 degrees. Not alarming yet, but on the drive home, Maya noticed Jasmine's breathing had changed. Faster, shallower, working harder. By the time they reached their apartment, Jasmine was using her accessory muscles to breathe, shoulders rising with each breath, nostrils flaring. Maya grabbed her personal pulse oximeter from her nursing bag. 92%. That was the moment Maya knew they weren't staying home. Within 15 minutes, Jasmine's oxygen saturation had dropped to 89%. Maya grabbed her jacket, scooped up Jasmine, and drove directly to St. Luke's Memorial, the closest ER. She arrived at 6:35 p.m., carried Jasmine through the automatic doors, and walked directly to the triage desk. Her daughter was in her arms, breathing rapidly, lips slightly dusky. Maya's nursing badge was visible on her jacket. She'd done nothing to attract negative attention. She'd violated no protocol. She'd simply arrived at an emergency room with a medical emergency. But to one person behind that triage desk, Maya Richardson's presence and her urgency were a problem. And that person had decided she knew better. Angela Pritchard was 46 years old. She'd been a registered nurse at St. Luke's Memorial for 11 years, spending all of them in the emergency department. She was experienced, efficient, and deeply protective of what she called the integrity of the triage process. She wanted the ER to run smoothly, to serve patients who truly needed emergency care, not people who came in for minor complaints that could wait for a primary care appointment. But over 11 years, Pritchard had developed a pattern that should have ended her employment years earlier. 14 formal complaints. 14. 9 of them involved allegations that she delayed or denied care to Black and Hispanic patients, based on assumptions about whether their complaints were legitimate. 4 had been sustained after investigation, resulting in written reprimands and mandatory cultural competency training. The other 10 had been closed with findings of insufficient evidence, though witness statements consistently described dismissive behavior and unexplained delays. Pritchard had a pattern. She questioned Black mothers who brought children in for respiratory complaints, suggesting they were overreacting to normal colds. She made Hispanic patients wait hours for abdominal pain, noting in charts that pain tolerance varies by culture. She challenged young Black men who came in with injuries, asking whether they'd been involved in gang activity before treating them. A woman brought her asthmatic son to the ER during an attack. Pritchard told her to use his inhaler at home and come back if it got worse. The child was admitted in respiratory failure 3 hours later. Complaint sustained. 1 week suspension without pay. Black man arrived with chest pain radiating to his jaw. Pritchard triaged him as non-urgent and told him to wait. He had a heart attack in the waiting room 90 minutes later. Complaint sustained. Final written warning. An elderly Latina woman came in with stroke symptoms. Pritchard assumed she didn't speak English well enough to accurately describe her symptoms and deprioritized her. The woman suffered permanent neurological damage. Complaint sustained. Mandatory retraining. The pattern was clear. The documentation was extensive, but somehow Pritchard remained at the triage desk, the first point of contact for patients whose lives depended on accurate, unbiased assessment. That Friday evening at 6:38 p.m., Pritchard looked up from her computer and saw Maya Richardson approaching with a child in her arms. In Pritchard's mind, she immediately made assumptions. Anxious mother, probably overreacting, probably here for a fever that doesn't need emergency care. She scanned the waiting room. It was packed. Real emergencies were waiting. A man with a possible heart attack, an elderly woman with a hip fracture. This woman with a child who looked tired wasn't jumping the line. She didn't consider that Maya was a trained ICU nurse, who understood triage better than most people in the building. She didn't notice the pulse oximeter on Jasmine's finger, or the dusky color of her lips. She just saw a black mother she decided was wasting her time. Maya approached the desk, Jasmine heavy in her arms. "I need to see a doctor right now. My daughter can't breathe properly." Pritchard barely looked up from her screen. "I'm sorry, but all our doctors are currently occupied. You'll need to wait." Maya felt alarm rising. This wasn't right. Wait? Her oxygen saturation is at 89%. That's dangerously low. She needs immediate attention. Pritchard's eyes flicked to Jasmine, then back to Maya, her expression hardening. "Ma'am, everyone here thinks their situation is an emergency. You'll be called when it's your turn." Maya set Jasmine down gently on a chair and leaned forward, her voice urgent but controlled. "I'm an ICU nurse at Mount Sinai. I know what a medical emergency looks like. This is hypoxia. My daughter needs oxygen now, not in 20 minutes. Pritchard's jaw tightened. "I don't care what you claim to be. Sit down and wait like everyone else." Maya pulled her hospital badge from her jacket and held it up, the blue Mount Sinai logo clearly visible, her photo and credentials printed in official hospital format. "This isn't a claim. I'm Maya Richardson, RN, BSN, ICU certified. I work in critical care. I'm telling you as a medical professional that my child is in respiratory distress." Pritchard glanced at the badge for maybe 2 seconds, her eyes barely focusing on it before returning to Maya's face with obvious skepticism. "Anyone can get a badge. Sit down. I'll call you when there's an opening." Maya felt something break inside her. She'd spent 12 years earning that badge. She'd worked overnight shifts and double shifts and holidays. She'd held dying patients' hands and called families with bad news and coded people back from death. She'd earned every letter after her name. And this woman was treating her credentials like they were printed at a copy shop. This is where bias becomes impenetrable. Nurse Pritchard had looked at Maya Richardson and made her decision before a single word was spoken. When Maya identified herself as an ICU nurse, Pritchard didn't see credentials. She saw a black woman claiming authority she couldn't possibly have. When Maya showed her hospital badge, Pritchard didn't see proof. She saw desperation to jump the line. Every piece of evidence after that, the pulse oximeter reading, the visible respiratory distress, the professional terminology, was filtered through that initial assumption. Pritchard wasn't looking at a medical emergency. She was looking at someone she'd decided was exaggerating. The waiting room had gone quiet. People turned to watch. A woman near the door pulled out her phone. Maya's voice rose, loud enough for everyone to hear. "My daughter's oxygen saturation is 89%. Normal is 95% or higher. She's tachypneic with accessory muscle use. That is textbook respiratory compromise. If you don't get her oxygen in the next 5 minutes, she could decompensate into respiratory failure." Pritchard stood up, her voice cold. "Ma'am, if you continue to cause a disturbance, I will have security remove you from the building." Maya stared at her, disbelief mixing with rising panic. "I'm not causing a disturbance. I'm describing my daughter's clinical presentation. Are you seriously refusing to triage a child with documented hypoxia? You're refusing to follow the process. Sit down or leave." "I'm not leaving. My daughter needs medical attention. I'm asking you one more time. Get a physician to this desk right now." Pritchard reached for the phone on her desk. "Security to triage desk, please. We have a parent refusing to comply with instructions." A man in the waiting room called out, "Her kid looks really sick. Why aren't you helping her?" Another voice added, "She said she's a nurse. Maybe you should listen." Pritchard ignored them. She sat back down and turned to her computer, effectively dismissing Maya. Maya felt her hands shaking. She looked down at Jasmine, whose breathing was getting worse. The child's lips were definitely dusky now, her chest heaving. Maya made a decision. If they wouldn't come to her, she'd go to them. She picked Jasmine up and walked past the triage desk toward the treatment area. "Ma'am, you cannot go back there." Maya kept walking. "I can, and I am. My daughter needs oxygen, and I'm going to get it." Pritchard came around the desk and grabbed Maya's arm. "You need to stop right now, or I'm calling the police." Maya pulled her arm free but didn't break stride. "Call whoever you want. I'm not letting my daughter go into respiratory failure in your waiting room because you don't believe I'm a nurse. Should nurses who refuse emergency treatment based on racial bias lose their licenses permanently? Drop your answer below." That's when Dr. Marcus Bennett walked into the waiting area. Dr. Bennett was the ER medical director, a 28-year veteran of emergency medicine who'd seen everything the job could throw at him. He'd worked in trauma centers in Detroit and Baltimore before coming to St. Luke's 5 years ago. He'd read Angela Pritchard's file. He'd reviewed the complaints. He'd been the one who recommended her termination after the third sustained complaint, only to be overruled by the hospital's chief nursing officer, who felt she deserved another chance. He'd been waiting for the moment when Pritchard's bias would create a lawsuit the hospital couldn't defend. Tonight felt like that moment. He approached the scene, taking in the situation immediately. Maya, holding a visibly distressed child. Pritchard blocking their path. Security approaching. Phones recording. "What's going on here?" Pritchard turned, her voice defensive. "This woman is trying to force her way into the treatment area. She refuses to wait her turn." Dr. Bennett looked at Maya. "What's your child's condition?" Maya's voice was steady, but her fear was visible. 7-year-old female. Fever 101. Progressive respiratory distress over the past 90 minutes. Current oxygen saturation 89% on my personal pulse ox. Tachypneic with accessory muscle use. Slight cyanosis around the lips. She needs oxygen and a full respiratory workup now. Dr. Bennett's eyes went wide. He looked at Jasmine, noting everything Maya had described, then turned to Pritchard. "Did you hear that clinical presentation? She claims to be a nurse, but did you hear the oxygen saturation she reported?" "Yes, but—" "And you told her to wait?" Maya pulled out her badge again. "I'm Maya Richardson, ICU nurse at Mount Sinai for 12 years. This is my daughter, Jasmine, and I've been trying to get her treatment for the past 8 minutes while her oxygen continues to drop." Dr. Bennett took the badge, examined it, and handed it back. "Nurse Richardson, I apologize on behalf of this hospital. Let's get Jasmine into a treatment room immediately." He turned to a nearby resident. "Room 3, high-flow oxygen, full respiratory panel, chest x-ray, and I want pediatrics paged stat." Then he turned back to Pritchard, his voice dropping to something cold and final. "My office. After your shift ends tonight." Pritchard's face went pale. "Dr. Bennett, I was following protocol." "You denied immediate care to a hypoxic child whose mother, a credentialed ICU nurse, told you exactly what was wrong. That's not protocol. That's negligence." He looked at her badge. "Give me your employee badge. You're suspended effective immediately pending investigation." Pritchard's hands shook as she unclipped her badge and handed it over. "I've been here 11 years, and you've had 14 complaints. In those 11 years, 14. 9 involving the exact same pattern I just witnessed, refusing to believe Black patients about their own medical emergencies." Dr. Bennett turned to Maya. "Nurse Richardson, I'm deeply sorry. This should never have happened. Once Jasmine is stabilized, I'd like to speak with you about what occurred here tonight." Maya nodded, already moving toward the treatment room with a respiratory therapist. Within 6 hours, the videos from the waiting room had spread across social media. Multiple angles showing Maya identifying herself, showing her badge, describing her daughter's symptoms in clinical terms, and being told to sit down and wait. Jasmine's labored breathing was visible. Maya's desperation was clear. Nurse Pritchard's dismissal was documented. ICU nurse begs for help for hypoxic daughter. ER nurse tells her to wait. Chicago nurse's daughter denied treatment despite 89% oxygen saturation. Black healthcare worker can't get care for own child at local hospital. The outrage was immediate and intense. The Illinois Nurses Association issued a statement condemning the incident. The National Association of Black Nurses called for an immediate investigation. Patient advocacy organizations demanded systemic reform. Angela Pritchard's nursing career imploded within 72 hours. She was placed on administrative leave, then terminated 11 days later after the hospital's internal investigation. St. Luke's issued a public statement acknowledging serious failures in care delivery and announcing immediate policy changes. But the real damage went beyond one nurse. The video showed what Black families had been saying for years. Even medical credentials, even professional knowledge, even a child struggling to breathe wasn't enough to overcome a nurse's assumptions about who deserves immediate care. Maya Richardson contacted an attorney the following week. The lawsuit named nurse Angela Pritchard for medical negligence and racial discrimination, Dr. Marcus Bennett's predecessor for supervisory failure, and St. Luke's Memorial Hospital for failure to train and supervise a nurse with 14 prior complaints. The claims were extensive: medical negligence and delayed treatment for a pediatric patient in respiratory distress, presenting with documented hypoxia below 90%, violation of the Emergency Medical Treatment and Labor Act, which requires emergency departments to provide appropriate medical screening regardless of race, racial discrimination in healthcare delivery, infliction of emotional distress on both mother and child, failure to train and supervise a nurse with a documented pattern of discriminatory care, and negligent retention of an employee with 14 complaints, 9 involving allegations of racial bias in care delivery. The complaint included Pritchard's complete disciplinary record: 14 complaints over 11 years, 4 sustained, multiple training sessions that produced no change in behavior, all documented, all filed, all insufficient to trigger termination, until she denied care to a nurse who knew exactly how to document the failure. St. Luke's attorneys reviewed the case and reached the inevitable conclusion: indefensible. The videos showed everything. The witnesses were numerous. The victim was a healthcare professional who could articulate exactly what went wrong and why. The hospital's own documentation proved they'd known about Pritchard's pattern for years. St. Luke's settled 14 months later. $3.8 million paid to Maya and Jasmine Richardson, split between compensation for medical negligence, emotional distress, and punitive damages. The settlement also required the hospital to implement a bias reporting system, with quarterly public reports on care disparities, mandatory annual implicit bias training for all ER staff with demonstrated competency testing, a patient advocate position specifically focused on health equity, and zero-tolerance policy for care refusal or delay based on patient demographics. Angela Pritchard was terminated 11 days after the incident. The termination letter was comprehensive and final. Nurse Pritchard denied immediate medical treatment to a pediatric patient presenting with documented hypoxia and respiratory distress. Despite being informed by the child's mother, a credentialed ICU nurse, of the severity of the condition, Nurse Pritchard refused to escalate care and threatened the family with removal from the facility. This incident represents the culmination of 11 years of complaints, alleging racially discriminatory care delivery. Despite 4 sustained complaints and multiple corrective action plans, Nurse Pritchard continued to demonstrate bias in patient assessment and treatment decisions. Her employment is terminated effective immediately. Her nursing license has been reported to the Illinois Department of Financial and Professional Regulation for disciplinary review. Pritchard's nursing license was suspended for 2 years by the state board, then permanently revoked after a hearing that reviewed her complete complaint history. Her 11-year career ended at age 46. Should healthcare workers who delay treatment based on racial bias face permanent license revocation? Let me know what you think. Maya Richardson testified at the Illinois State Senate Health Committee hearing on racial disparities in emergency care. Her testimony was powerful and precise. I'm an ICU nurse with 12 years of experience. I've managed respiratory failure in patients of all ages. I know what hypoxia looks like. I know what respiratory distress sounds like. I know when a child needs oxygen immediately. She paused, her voice steady but weighted with emotion. And I stood in that emergency room, holding my struggling daughter, showing my credentials, citing clinical signs, and I was told to sit down and wait. Not because my assessment was wrong, The doctors confirmed everything I said was accurate, but because Nurse Pritchard looked at me, saw a black woman, and decided I was exaggerating. Another pause. 14 complaints in 11 years. 4 of them sustained. 9 of them involving the exact same pattern. Dismissing Black and Hispanic patients' medical concerns. That's not bad luck. That's not isolated incidents. That's a pattern the hospital documented, trained her about, and allowed to continue. Her voice strengthened. The settlement was $3.8 million. That's significant money, and it represents accountability. But it doesn't undo the terror of watching my daughter struggle to breathe, while someone with the power to help refused to act. It doesn't erase the message that even being a nurse myself wasn't enough to be believed. She looked directly at the committee. If this can happen to me, an ICU nurse who works in the same healthcare system, what happens to mothers who don't have medical training? What happens to families who don't know the clinical terminology to describe what they're seeing? What happens to people whose children are dying, and they can't convince the gatekeeper to let them through? The room was silent. This wasn't about one nurse having a bad day. This was about a hospital that kept a nurse at the triage desk after 14 complaints because they valued avoiding conflict more than protecting patients. This was about a healthcare system that tells Black families their concerns aren't valid until their children stop breathing. Do you think hospitals should be required to remove nurses from patient care after 3 sustained complaints of discriminatory treatment? Drop your answer below. This wasn't just about Angela Pritchard refusing to treat one child. This was about a system that documented 14 complaints over 11 years and decided that retraining was sufficient. 4 sustained complaints. 4 times the hospital concluded that Pritchard had discriminated against patients based on race. And 4 times they sent her back to the triage desk, the single most critical position in the emergency department, where split-second decisions determine who lives and who dies. Pritchard's record told a story her supervisors chose to ignore. She questioned Black mothers about whether their children were really sick enough to be there. She made Hispanic patients wait hours for complaints that white patients were seen for immediately. She challenged young Black men about whether their injuries were gang-related before assessing medical need. The pattern was clear. The documentation was comprehensive. But the hospital treated each incident separately, never connecting the dots, never acknowledging what 14 complaints in 11 years meant. This nurse should not be making decisions about who deserves emergency care. The day Pritchard delayed treatment for Jasmine Richardson, that child's oxygen saturation was 89%. Normal is 95-100%. Below 90% is medical emergency territory. Below 85% is respiratory failure. Jasmine was 4 percentage points away from needing a ventilator. And Nurse Pritchard, who'd worked in emergency medicine for 11 years, looked at those numbers and decided the child could wait. She made that decision not because she couldn't recognize respiratory distress. She'd been trained to spot it. She made it because she looked at Maya Richardson, a Black woman, and decided that Black mothers exaggerate, that they panic unnecessarily, that they bring their children to the ER for colds, and demand immediate attention for problems that aren't emergencies. And when Maya showed her ICU nursing badge, when she used clinical terminology like hypoxia and tachypneic, when she cited specific oxygen saturation numbers, Pritchard didn't think, this woman knows what she's talking about. She thought, this woman is trying to manipulate me with medical language. That's how complete racial bias becomes. It doesn't just dismiss evidence. It reinterprets evidence as proof of deception. The more qualified Maya appeared, the more suspicious Pritchard became. The nurse's credentials became evidence that she was too clever, too prepared, too insistent, all signs, in Pritchard's biased assessment, of someone gaming the system. Angela Pritchard's career is over. That's justice. The hospital paid $3.8 million. That's accountability. Her nursing license was permanently revoked. That's consequences. But money and termination don't erase the trauma of begging strangers to help your dying child. They don't restore the trust Black families are supposed to have in healthcare systems. They don't undo the message that even being a nurse yourself isn't enough to protect your child when racism decides you're lying. The real question is, what changes now? Do hospitals finally remove nurses from patient care after 3 sustained discrimination complaints instead of waiting until 14? Do state licensing boards finally track patterns of biased care delivery and revoke licenses before children are endangered? Do we finally acknowledge that healthcare disparities aren't just about access to insurance? They're about Black patients being systematically dismissed, disbelieved, and denied care even when they arrive at emergency rooms with documented medical emergencies? Because if we don't fix the systems that kept Pritchard at the triage desk for 11 years despite 14 complaints, if we don't address the culture that made hospital administrators choose conflict avoidance over patient safety, then we're just waiting for the next nurse, the next mother, the next child struggling to breathe, while someone with the power to help decides they don't deserve it. Comment if you believe this should be law. Healthcare facilities that retain staff with 3 or more sustained complaints of discriminatory care face mandatory federal investigation and loss of Medicare via Medicaid funding. And if you think these stories need to be told, if you believe accountability starts with awareness and change starts with pressure, then hit that subscribe button. We're not stopping. We're going to keep exposing these patterns of bias in healthcare, policing, education, anywhere systemic racism operates under the cover of policy and procedure. We're going to keep demanding better. We're going to keep fighting for the mothers who shouldn't have to be ICU nurses to get emergency care for their children, for the families who deserve to be believed when they say someone they love is dying, for the patients who shouldn't have to prove their humanity before receiving medical treatment. This isn't just about one nurse or one hospital or one mother and daughter. It's about all of us and the healthcare system we're willing to accept.